We are having a health talk discussion with a series of different healthcare providers, and we have the honor of speaking to Alysha Henry Johnson, physician assistant with Spora Health. How are you doing?
Good morning. I'm doing well this morning. How are you?
I'm fine. I'm fine. Just want to say thank you so much for taking out your, taking the time out of your busy schedule to have a brief conversation with us about health and wellness. And just so we can, we can get right into it. Can you share your position and your experience with health and wellness?
Oh, good morning again, and thank you for having me. So I am a physician assistant. I've been a practicing PA since 2009, and my experience with health and wellness has been in many forms, whether clinically, helping. It's been mostly clinical, working in primary care, cardiology, emergency medicine, and occupational health and women's health. So my experience with that has been very fulfilling regarding patients that we've been able to help and improve their health and wellness with, shared decision making and giving patients that education and empowerment to making a positive impact on their health.
That's awesome.
We do have a lot of education and several years of training. I can speak to that of PA because I did go to PA school.
Yes, I'm sorry.
And basically, you have your undergrad that you do, and then you have your PA education, which is typically anywhere between 2.5 to 3 year program, depending on any sort of specialty or residencies that you would like to complete. And we're trained in a medical model, and we train with other medical students, residents, and physicians. And we have a lot of clinical hours that need to be completed in order to graduate and sit for our exams. And it's a very rigorous program. And if I say I'd had to do it again, I'd probably think back to all the sleepless nights and stress related to it.
Yeah, but you made it. You made it.
You made it, and it was well worth it. It was well worth it. And if I had to do it again, I would do it again.
That's awesome.
It is fulfilling, and I love what I do, and I love being able to help my patients and make an impact on them.
In regards to your role with Spora Health, are you working alongside with them or as one of the physician assistants? Is that your?
Yeah, so yeah, I work with Spora as a physician assistant, and our platform is strictly telemedicine at this time. And the one thing that attracted me to Spora is their focus on making sure, or not so much making sure, but putting culturally competency in the forefront of everything that we do regarding our patient care. The philosophy of one size fits all is not something that we are not, something that we ascribe to. We like to recognize everyone's differences and respect those differences, and also make sure that any sort of treatment plan that we develop is inclusive of that patient's cultural background. And with that being part of the process, it helps the patient more because it's something that they're going to be able to stick with, so to speak.
Yeah.
So I like that about Spora, and the fact that it is telemedicine, because we are able to reach people that may not be able to get to an office, and we can meet the patient where they are.
Awesome. And it's definitely important to, make that initiative to meet the patient where they are. What is your perspective on obesity?
So in general, I mean, obesity can be a, a multifactorial problem or issue. Um, in some patients, it can be, reasons for stress, hereditary conditions where they have a health issue that they require taking medications for, and those medications cause them to be overweight, um, or just medical conditions in and of itself that predispose that patient to be a little heavier. But in regards to obesity, the treatment and approaching it with patients is obviously case by case, and finding out what the patient's um, sort of why is when they're coming to say, okay, I would like to address this issue, like finding out that reason why that it's so important to them to make that change, is key to really being effective into getting results and making a positive impact and changing, their lifestyle and so forth. Because a lot of the times, sometimes it is just a lifestyle. People like to go out to eat and unhealthy habits and things of
Traditional
that nature.
culture and traditional habits. Yeah, so
Yes,
it
exactly.
that as well. One of the other topics that I wanted to touch base was with diabetes. Um, I don't know the numbers statistically, on which group is affected by diabetes at large. But would you be able to share some insight on which group or is affected and what are some tips or, insight that we can share to the audience in regards to those who are affected or have potentially can be affected, being that it may be hereditary or so forth?
Right. So typically, if you have a family member that is diabetic, there are chances in your family history that you could develop diabetes as well. As far as demographically, um, diabetes tends to affect the African American population a bit more, but it does affect everyone.
Everyone.
Just yeah, just as much. I think sometimes the issue um, with diabetes is being able to have it treated, or not so much being able to have it treated, but understanding your treatment so that other issues down the line don't occur, like amputations or having retina issues, vision issues, and so on and so forth. So um, yes, certain communities can be affected more, but I think that the education in treating and managing your diabetes is different.
Mm.
And that can be basically, well, we know that in the African American population, they may not trust their providers as much, and therefore they may not go and see the doctor as often or ask questions and so on and so forth. So if we're able to educate the patient better about managing their diabetes, what they should and shouldn't be doing, or substitutions that they can make in their daily routine to help them manage their condition better. Um, those are things that we like to do as providers, because we want to empower the patient so they can manage their condition better. So we can't be with them 24/7. You can't eat that, don't do that. But if they have that education, they can, manage their condition better and live a healthier life.
Yeah. What are some tips that you can share to patients when it comes to being transparent with your provider? I know sometimes patients don't, sometimes from my experience, communicate with other people, they're reluctant to even share certain things with their provider based off previous experience. What are some things that you can say to a patient that is not being honest on the information they're sharing or is not being forthright with what's really happening to the provider, and how that can affect the care and how the provider helps them?
That's a really great question. And I think that transparency is a big percentage of why things will go untreated, because patients may not speak up, and it could be for various amount of reasons, whether it's a trust issue or if they just don't feel comfortable. But it is extremely important for patients to be as transparent as possible, because as providers, if we don't know that you're doing XYZ, that can affect ABC, and that will affect the treatment plan. So it's really important for the patient to be as transparent as possible. And I can only speak for myself, but I don't pass judgment, and no other provider should as well, because we're here to provide care. And transparency is the best way to be able to make sure all your issues are being addressed.
Transparency is definitely important. When you think about medication, when you think about the plan for you, and sometimes you may leave a situation saying, I don't like that doctor, what the doctor gave me didn't work, or that didn't, it didn't work for me. And not being any honest with yourself, or holding yourself accountable, that you really didn't give them all the information. Because the medication may not be working because you're not telling them that this, that, and the other half of, other situations. And this is not patient blaming, because, this is just shut up and talk about wellness lifestyle brand. We like to be clear and honest. I've been in situations where I've been uncomfortable, or I felt like my voice wasn't heard, or I felt like it was just shoving medication. That is such a turn off for me as a patient. It's like the idea of just making an educated guess. So even though if I, the patient, express my pain or my discomfort, I've experienced where some doctors, they're like, well, this is what it is. They tell me what I'm feeling. And, I'm glad that there are entities like Spora Health, where you as a patient, you have an option to filter out, to see, to get someone that looks like you or may be able to understand um, who you are. I think you mentioned cultural competence.
Exactly, yes. Yeah, so basically with Spora, we are open to seeing patients, not only in Florida, California, we're rolling out in Texas, Virginia. So we are definitely up and running and ready to see patients and ready to help those who want help.
And what's the process? How do they find you guys?
So everything is online, and you can go to sporahealth.com, and there'll be a little pop-up section where if you want to be seen, you can text in a message, or you can click on book appointment, and you can get connected with one of our great providers, including myself, where we will listen to you and address your complaints or issues as best as possible. And we look forward to, helping everyone.
Awesome. All right, well, ladies and gentlemen, thank you so much for tuning into our community health talk. We have the honor of speaking to physician assistant Alysha Johnson, correct?
Correct, that's it.
All right, sorry about that. Ladies and gentlemen, do remember to go to sporahealth.com. I came across Spora Health on Instagram. They do have an Instagram page. Go to the website. I believe they have an app as well. Download their app and get in tune and find providers that are culturally competent. Thank you guys for tuning in.
Bye.